3 out of every 1,000 children born has a port wine stain, which is made up of numerous dilated blood vessels in a localized part of the skin. They can occur anywhere on the body, but most patients who seek laser treatment have port wine stains on their face or neck.
The port wine stain came actually soon after birth, within the first few months, and that's typically what happens with them, and it continued to grow, and it continues to grow with you. Having the port wine stain did change the way I did a few things. I might not have admitted that to anybody, but I knew inside things like wearing makeup all the time when I would go out of the house. I wouldn't go out without having it on. The changes that occurred mostly happened during pregnancy, and then as I got into my older years, into my 40s, there would actually be little papules that would form on my cheek, probably due to the hormone changes in your body. And I literally had to have several of them removed and have stitches because they just wouldn't go away. I also had swelling. I had some infections. So I eventually was on antibiotics and prednisone during each one of these instances. And finally, my family doctor said, "You have to do something about this."
The vast majority of patients with port wine stains benefit greatly from serial pulse dye laser therapy. About 15 to 20% of patients will have complete resolution of their port wine stain, or nearly so, and the vast majority of patients, probably 75 or 80% of patients, will have very significant clearance of the port wine stain, meaning lightening of at least 50 to 75%. Although we do believe that it's optimal to have patients start their treatments for the port wine stains very early in life, I can also say that we've treated patients throughout the life cycle of port wine stains, even into late adulthood, often with very dramatic results. In the Cosmetic Dermatology and Laser Center here at the University of Michigan, we do a great deal of research regarding laser therapy, looking at the molecular mechanisms that underlie the clinical benefits that we all see with laser treatments. We believe that by better understanding how the laser energy impacts the skin on a molecular level, we're more likely to be able to develop optimal treatment parameters that will benefit our patients down the line.
I am so happy with the results. I never realized just how much it did affect me. I didn't have to put on the layers of makeup. I just put on one layer like anyone would. I have not had any infections. I haven't had to be on antibiotics, no more prednisone. So that's really a wonderful end result. I had to have a medical thing done, and I got some cosmetic result, which was a bonus, and it's been really nice.